Hello, my wonderful people. I send you greeting wherever you are watching me all over the world at the moment. I say, may God bless each and every one of you. I hope you're all keeping well by the special grace of God and looking after yourself as it should be. I just want to let you, remind you from where we stopped last time and where we're going. Remember, we started treating a condition of kidney care and conditions. Yeah, a series of kidney care and conditions. And we have done part one and part two. And in part one, we did about prevention of kidney diseases, kidney problems. We talked a lot about it. If you go back to my previous videos, you're gonna see all these and watch them again if you have forgotten or you want to remind yourself before you get into what we are going to talk about today. And in the part two, we talked about, how do you notice when you have problem with your kidneys. We talked about taking care of the kidneys, and then we talked about conditions. We now gonna talk about signs and symptoms in part three. What do you see? And then you begin to think, oh, this might be kidney condition coming in. Okay? So we talked about, as I said, I recap, we said we're into series of kidney care and conditions. And in part one, we talked about prevention of kidney problems. Kidney, what do you do? What can you do to prevent yourself from getting into having kidney problems? What can be done, to get you out of getting into it? So that is what we are talking about in the past, and that is the part one. And in the part two, we talked about kidney diseases, the types, and causes, remember. And then today we're gonna deal with signs and symptoms, and that will be the part three of our series. So keep on following this channel, keep on following me, and you get into know much about your kidney and to how to take care of it and what to do at one point in time. Okay, so today we're going to talk about signs and symptoms of kidney diseases, and we say that oftentimes kidney diseases in early stages, they show few or not even no symptom at all. At the early stage of kidney disease, it doesn't show any sign or symptoms, or it shows slightly that it might be overlooked. Okay, that it can be noticed or not even experienced or noticed at all at the early stage of kidney problems. That's why kidney disease, that's why you need to be so mindful, be so conscious about when certain things are setting in, and take note of it and visit your doctor or do what we call MOT, that is done in cars. That is in the United Kingdom here, we do MOT for cars. That is the Ministry of Test of of the company, of the government part of the that looked after vehicles. Make sure you take your car for MOT every year for it to be roadworthy. So also, as we are human beings, we should look after ourselves and go for checkups, go for our own body checkup, so that we make sure everything are working fine. And if there is any derailing or any deviation from normal, is caught on time and be treated, and you get free. So that's what we're advising on that. So as we go on this topic of today, we say the early stage, because there's early stage in kidney failure, in not kidney failure this time, the kidney disease when it's setting in. And in this early stage, it may be asymptomatic. That is, there will be no symptoms at all. You will not notice anything. You will not even feel anything. And then it says to take note of this, that kidney disease can progress without you feeling anything. or noticing anything. I'm just hammering this. This is a fact. A lot of people just say, kidney disease just come out boom like that, and they just feel so sick, start feeling the advanced stage as symptoms and all whatnots, but it didn't give them much or any sign or symptoms at all. So it can be accidentally discovered. Yes, it can be accidentally discovered through urine tests or blood tests of, maybe you've gone for tests, something else is wrong, and you go for tests, or you go to see your doctor, and doctor send you for urine tests or blood tests. From there, it could be detected. But you never felt and you never knew that it was kidney disease coming in. So that's why we need to be very careful and be sensitive to our body, and go for checkup, you know. So, and then in number two thing, we're going to talk about it. We talked about the early stage, which is number one. Number two now, the later stage. Later stage now, it will become symptomatic. You begin to notice some, feeling, you begin to see certain things, you begin to feel, number one, you feel tired. You feel so much tired, you feel so weak in within you, and this tiredness becomes so constant. The tiredness and weakness become so constant, and this is so common in kidney disease. And this is due to the fact that the erythropoietin, which is a hormone in the body which stimulates red blood cells production in the kidney, because the kidney is now having problem, it's no more producing it, and is declined, is reduced, and then this leads to anemia. And when somebody is anemic, the person feels so tired. That's one of the symptoms of anemia, tiredness, because the kidney is the major organ that functions to stimulate this hormone, erythropoietin, to be able to produce red cells that helps us to avoid being anemic. So when there's kidney problems, this hormone struggles to stimulate the kidney any longer to produce the red blood cells, which prevents anemia, and the person becomes so tired and so weak. And then the second thing you'll start noticing, it will be swelling, especially in the ankles, the feet, the hands, the face, And in this case, there is, because the kidney is now having problems, it cannot filter fluid. It cannot filter the water you drink. Every food that contains some water which you drink on daily basis, the kidney now struggle to filter them out. They all accumulate in the blood. They all accumulate in the body, all making the person to swell all over. And when you see somebody swelling like that, most cases it is kidney condition, kidney disease. Then the number three thing here is shortness of breath. The person begins to experience shortness of breath, in short form SOB. The person will struggle to breathe. The person will be breathing up, and will not be able to bring down easily. You see the person going that way, going up, and the breathing being so abnormal. Even if in a little exertion, in a little getting up from the seat or from the bed to walk along a little step up there, the person begins to, start to pant, start to worry, start to look for air, hunger for air, and breathing becomes very, very difficult. And this is due to fluid buildup in the lungs. And the lungs now struggles to breathe. This is what the kidneys in our body, the little organs we have in our body, towards the back of our body, left and right, two of them, this is what they do, and now they are in trouble. It might be one kidney that is having problem at some point. Two of them might be having problem at the same time. And don't forget, you remember, some people are born with only one kidney and they never had problem. And then when by any chance, unluckily, maybe the person with one kidney now starts having problem, you can see what that means. So be aware of that. Then the fourth thing to notice will be changes in urination. You know, especially at night, the person starts experiencing that you're urinating so much. Instead of getting up, maybe to urinate only once, you see yourself urinating 2 times, 3 times, 4 times. As much as unusual as what normally, the frequency you urinate at night. The urination becomes so frequently, and this will disturb your sleep. Again, the kidney is struggling to concentrate urine. And then you see yourself passing urine that is so watery, so looking like plain water. And then that is to say that the kidney is now having problem and it cannot concentrate the urine effectively, due to the fact of the disease condition of the kidney. And then upon these changes of decrease in urination, changes in urination, frequent one, sometimes it will be decreased. You can go into the restroom to you have the feeling to go, the urge to go, and you go there, you just pass a little amount of urination. But this is a little amount of urine, and this is something that it was coming so urgently, as if your bladder is full, as if so much in there. But when you get in there, you find out that it's just a little drop, and the output is significantly reducing. This is because the kidney is in trouble. So we have to be aware when we start experiencing certain things, especially in this aspect of urination. It can be the cause of some other thing, but it is good to go and report to your doctor. Don't keep quiet. It might be something else. It might be something else. It might not be kidney problem, but in kidney problem, you experience this. Yeah. Like in men, when they have enlarged prostate, the urination starts decreasing, or they struggle to to empty their bladder completely. It comes in drop, or it comes and go, or it might not even come out at all. And the bladder, urethra, everything in there, the urinary system will start getting engorged and problem. That is a different issue altogether. But what we are saying here is that if you're having such a problem with your urination, please go report to your doctor for immediate investigation. Yes. Then another thing we can talk about here is you start experiencing foamy or discoloration of urine. You might see when you urinate, you see your urine now foams a lot. It foams like, when you put water in, soap in water, and it foams, very foamy. And then it can be of maybe discolored to pinkish or reddish. And this indicates that there is protein in urine. The foamy aspect of it is that you are now passing protein, which your body is supposed to absorb to make use of build the muscles and things like that. It's now being passed through urine because the kidney is not functioning well, and the blood stain is due to now your stain of your urine is because you're now passing blood as well in your urine, because the kidney is struggling. Very powerful organs that do a wonderful job in our body. Then the next one you begin to notice, is you start having nausea and vomiting. The person starts having nausea and vomiting. This is usually as a result of waste products in the body building up in the blood. You keep feeling vomiting. Sometimes you vomit, and as this is just explained in the sense that the waste product, the end product of metabolism. Now you're now seeing urea, a lot of urine in urea in your urine, which is as a result of breaking down of protein, and you start seeing excessive water because the water is not being controlled, and then or little of water, urine being passed, and then you have salts being excreted so much from your body, and other metabolic byproducts. You see, and this can be in form of what we call the creatinine and uric acid. They all start showing your urine in excessive amount, and then the electrolyte as well. You start showing a lot, you start losing them. Even the ones that the body could absorb to keep, like this electrolyte in a small quantity that the body needs, like sodium, the potassium, and chloride. They now come a lot in your urine. You start passing a lot of them because the kidney is not functioning to keep them in equilibrium or in balance. Okay, so please, you need to check yourself out. Please report to your doctor. Always check yourself up and make sure you're taking care of yourself. And then the next one is loss of appetite. You find out that you don't have you don't have appetite to eat anymore. You don't want to eat. You don't feel like eating, and your appetite has decreased. You feel full even when you have not eaten. Even when you have eaten little amount of food, you feel so full. You feel so bloated up as if you have eaten a whole bowl of food, but if just a little amount. It's just because the kidney is not functioning, and there's excessive water and everything is in excess that is backlogged into the bloodstream. And then another thing that one can notice when kidney disease comes in is dry and itchy skin. This is so common. When you start having excessive itching of the body, your skin start itching so much, it can be a sign of kidney disease setting in. And this is due to because the kidney played an important role in regulating mineral and fluid balance in the body. As we said before, the kidney plays a very big role in balancing all this, regulating the body and the fluid and mineral in the body. And when this is above due to decrease of the kidney, it leads to skin problem, the itchy. Sometimes you notice scaly itch, your skin will start scaling off, you start itching, you start having rashes. Every time you're itching, you feel like scratching yourself. You might even scratch yourself that you may start bleeding. Some people, you see them start scratching themselves that all over they start bleeding, bleeding out of the scratches. So please keep an eye and go for a checkup and see what is happening in your system. And then the eighth one you can also notice is that you start having metallic type of taste in your mouth. You feel that you have like metal. You have eating raw metal in your body. And this is due to build up of waste product in the blood, as we have talked about, the chemical or the urates or the electrolyte that are building up in the body, and the mouth start, perceiving the taste of it as metallic. Okay, because they are minerals in nature that the body needs, but all of them are piled in the body. None is going out. Or some of them that are supposed to leave the body, they are leaving. Some are supposed to stay, they are not staying. It's just like everything being in balance. Walking haphazardly up and down anyhow. All right. And then the next one you have, this is ninth thing you can, observe when you have kidney disease set in, is muscle cramps. Sometimes due to muscle cramps can be, yes, when you have sports, you do a lot of sports, you start having muscle cramps and something like that. Yes, because a lot of electrolyte have been released into the muscle system, into the blood system. Yes, with kidney disease, you experience such because this electrolyte imbalance, they can cause muscle to cramp, and then you start feeling weaknesses of muscles, because the kidney could not balance them very well. Then the next one you also experience is high blood pressure. Kidney disease, this go pari passu with high blood pressure. A lot of people had their kidney fail because of high blood pressure unnoticed. They have very high blood pressure, which they never gone to hospital to check on to know what is happening, and they were having this blood pressure without knowing they have it, and it keeps, destroying the kidney. And then with kidney disease also, the blood pressure also goes high. It's just work, pari passu, vice versa, so to say, you know, high blood pressure, kidney problem, high blood pressure. So please go often and check yourself so you make sure everything is working orderly. All right. Then another thing you also experience, this is 11 points. So many stuff happening in this body, our body, when any of the organs is in trouble. So when the kidney disease is on, you start having pain around the loin. That sometimes a lot of people notice it at at the middle of the disease or beginning, or when it's advanced. But just because the kidney is in trouble and it is now going through disease condition, the pain, because it's working too hard, overworking itself to make sure it keeps up to what it should, and then you find out that you start feeling pain at the loin area, at the back, the position, because the position of the kidney is towards the back, in the rib cage towards the back. Two of them, one at the left, one at the right. But then if somebody has only one, as I said earlier, it has been proven. I have seen somebody born with only one kidney. And this person, a friend of mine, she found out only when he was 62 years old. You can imagine. And some people have lived with it, and they never had problem. And this a friend of mine never had kidney disease. He just like he went for an operation and they were checking and doing MRI. We found out that he has only one kidney. That is God for you. Okay, so we have to be very, very careful with our kidney and with our health altogether. Get on to see your doctor, please, for investigation. Don't wait until things get worse. Don't wait or you start feeling pain. You just ignore it and say, oh, this does not mean anything. It can mean anything. Go for a checkup. It's so important. When it's found early, when it's detected early, it can be treated. It can be prevented. It can be, handled so that you don't go into more complicated stage of kidney disease. Okay, and which can be into you find yourself getting into chronic kidney disease, which now can lead into dialysis. You now require dialysis or kidney transplant. It's not an easy thing to go by. Please. Now the exacerbation of the signs and symptoms when you go into the chronic stage of the advanced stage of kidney disease, you start having all the things we have mentioned. They now go on a higher level. The person start experiencing weight loss this time around because he's been losing a lot of nutrients, he's been losing a lot of electrolytes, he's been losing a lot of water, not eating at all, not eating. Sometimes some people can't even eat at all. The body is just not, is just like nothing to write home about, and very poor appetite, excessive swelling. The swelling increased. The shortness of breath increase. The person may not even be able to breathe again. That some people are being given oxygen to be able to breathe. You can imagine to that advanced and complicated stage of kidney problems. And then low energy, very, very fatigue, and some people will start to constantly vomit. They go on vomiting, endless vomiting. And when somebody is vomiting, vomiting can render somebody useless. It can make you feel horrible. Some people will say it's better they have diarrhea than vomiting. None of them is good though, but vomiting it drains one so much. And this is what people with kidney disease, especially at a very advanced, complicated stage, they go through. And remember, if these signs and symptoms, if this is detected early, especially when you start feeling any of those earlier time, if it is, I repeat, and it's a fact, if it is detected early, it can be treated and the chronic kidney disease can be prevented, and it can progress. Its progress can be slowed down and the person can get back himself or herself. I want to sound a note for you. Remember, I'm not just talking as talking sake. I am talking and teaching and updating, and bringing you awareness from experience. I've been a nurse for over 30 something years, and I've been a dialysis nurse in the Kidney Institute of um, National Hospital in the United Kingdom for 23 good years. So I am talking from experience. And I just want you to take things serious, because kidney disease is not something some people will say, somebody was saying, well, if I get kidney disease, I'll quickly go for a transplant. It's not easy. It's not easy. There's nothing like quickly go for a transplant. There's nothing quickly in that. It can be easier said, but it's not easily done. Because I'm telling you, before even you get, even if you have, before you get somebody or a donor or a kidney, so to say, you have to go through process. Even if a relative or a friend or a well-wisher is donating kidney to you, the process of doing it, because you have to go for investigation, the person has to go for investigation to see if you are a match, and then after that there's other things, a lot of work to be done, blood works and all sorts of investigations to be done. It's not done at a go, it's done stage by stage before you know that you are a match. And then if you are a match and then you have the kidney transplant, remember, sometimes there are percentages of failure of that transplant. Some people have had transplant and before few days, the whole thing went into disarray. It's not working. It makes the person feel worse. And the person rejects, even though work has been done to see if the people match, the donor and the donee, they match. Sometimes you still do that, the body will start to reject it. And it might not work in some cases. And then the person has to be taken back to theater to take out the kidney. And then it cannot put it back into the person that it has been removed from. The person has lost a kidney, and the person that received it did not receive it. It did not work out. So please, don't think that it is easy. It is not easy. So they say prevention is better than cure. So please take care of yourself. Take care of your kidney. It's so important. It's so important. Very, very important. It doesn't take much to go to hospital and check yourself. As I repeat, I reiterate, if it's detected earlier that some of those symptoms and signs we mentioned earlier on is detected, you'll be treated and that will be okay. And then you come out of the treatment, and it's better than allowing yourself to be drained and drenched into complication of kidney disease, and then you start running around, running helter-skelter. Okay? And then in some countries, to get kidney is not easy. Even when you get your relative, some people and their relatives, They don't match. They don't match. For the fact that person is your blood relative does not mean that your kidney and the person's kidney will match. It doesn't work that way. It doesn't work that way. You know, you'll be surprised when people, the whole family agree to donate. Everyone's okay, check me. You're gonna check me, I don't mind. And after checking, all the family members, none of them will match. But it comes to be an outsider, maybe a friend or a well wisher, you know, that we match. And as I said, after doing it, in some cases, it will fail. But don't get me wrong. Don't get me wrong. In some cases as well, it works. I have seen a lot of people who had kidney transplant and they had it for 10 years, 20 years. It worked for them. And then it started having problem again, and then started failing again. And then they had to come back to dialysis, depending on if the person is on hemodialysis or peritoneal dialysis, the one they do at home, or the hemodialysis, the one done in hospitals or kidney units, or at home. Some people dialyze, do hemodialysis at home as well. Those who are able and capable and who can manage themselves. That would be a topic for another day. Dialysis, and all the things like that. So for today, we have talked about the part 3 of our kidney care and conditions. Today is about signs and symptoms of kidney disease. And what do you do? Nothing but, please, I beg of you, make sure you go for regular checkups, even if it is once a year. I know in some countries it's hard, things are so hard, everything is so expensive, medical care is not affordable for so many people, but please, as much as you can, go for a hospital that you can reach. It might not have to be on what do you call it, the tertiary hospitals. Primary health care can help you, to take you through health check. Okay, then you make sure you have yourself checked as often as you can. Okay, don't run away from it. Just keep looking after yourself. And I will say, please, let me just use this opportunity to thank all of you for supporting me, for watching my channel and subscribing and commenting and giving me thumbs up. Thank you so much. And I thank also those who have not watched my channel before, who will be watching anytime from today. Thank you in advance. I thank you so much. And please don't forget to share. Don't forget to share, please, after watching. Don't forget to share. Comment. Give me thumb up and share. Sharing is to bring awareness. Let your people know. Let your friends know. Some people are not aware, because you might be thinking everybody knows what we are talking about here now. Not everybody knows. But because I was getting some feedback and some reviews, telephone calls, and people were telling me, oh, I really benefited a lot. I listened to your videos and they really blessed me. There are certain things I never knew, and it really opened my eyes. One of my friends said, when I talked about body MOT, she came to me, she said, give me a hug. I just opened my arm and gave her a very big hug. I didn't know why I was hugging her. And I said, why are we doing this sudden hug? She said to me, thank you, my sister, for blessing me. You really made me to go for my cervical screening and my yearly, not yearly, is not done yearly here in this country where we are. Depending on your age, you go for a breast screening, periodically depending on your age and your cervical screening. Thank you for telling me. Thank you for your topic and your teaching. It really boosts me up. It's really made me, and I went. And to be honest, I've been worried about it. I said at my age, who knows what will be happening? And I thank God that I went. The result came out, and nothing at all. They are all normal, and I was so happy. I said, you see. So please, and then she said she shared to so many people, you know. So please share, bless others. We are here to help one another. You know, nobody knows it all. I myself, I go to people's channel. I go to people's channel and watch it, you know, the educative things I know that can help me about, you know, this life. And remember about this channel, we said it's a holistic living. We talked about everything in life that will help us to live this life to the fullest. Even as a Christian, a believer of the good book, the Bible, we also talk about, you know, believing in God, trusting in God, things you can do to get yourself uplifted and get out of every situation that might be challenging to you. Okay? So please share. Don't forget to look after yourself. Take care of your kidney. Go for a test so you know. Watch your body. If you feel any of those symptoms and you see any of those, if you feel any of those symptoms, yes, and if you see any of those signs, please go for a checkup. Or you might not even see any of them, go for a regular checkup at least once a year. It even makes your mind to be at rest when you go and they say, oh, there is nothing, everything is normal. And even if they detect anything, it will be treated. And the earlier, the better. The earlier detected, the better. And then you'll be free. Thank you very much. I thank you once again. And please keep watching. Keep watching. Keep your eyes on my channel when I'll be dropping another video. May God bless you all. Thank you for watching, and God bless you.